Richard Lafayette. I'm a professor of medicine at Stanford University. I run our Stanford Glomerular Disease Center as well as our fellowship program, and I've been studying glomerular diseases for a while now and have a special interest in IgA nephropathy. So IgA nephropathy is considered the most common primary kidney filter or glomerular disease in the world. However, in the United States, that accounts for probably just over 100,000 individuals having the disease and about 4,000 to 5,000 new cases every year. It's typically a disease of young people, which is unfortunate because sometimes people in their late teens, early 20s, or into their 30s will come forward with the disease. It's often a silent disease. Sometimes patients have obvious blood in the urine, especially when they have a concurrent cold or respiratory infection. But more often, it's only found if we look for it by looking for mild elevations in blood pressure, a little bit of swelling, but particularly look for blood and protein in the urine and early decline in kidney function. We've got to look early, otherwise patients often present a little bit late when their kidney function is already irreversibly decreased. The issue is that when we look really carefully, patients are a little bit fatigued. They have some body discomfort. They have a little bit of swelling, but the symptoms are not usually the focus. The risk is that the patients move on to kidney failure. And again, this is young women, young men, a little predominance from the Asian community, Hispanic community. And it's really important to focus on kidney function and try to be sure that we're monitoring that and doing everything we can to limit the progression of the disease because symptoms really come up when patients lose kidney function. Just a few years ago, they were mainly managed with blood pressure control, lifestyle modifications to eat healthy, to exercise, to make sure their blood pressure was well controlled. And then we used a group of medications to limit angiotensin II activity, the RAS inhibitors. And if patients had a more severe presentation, we would use systemic immunosuppression, which ran the risk of lots of complications. More recently, the FDA has approved some new medications where we can target the immune response a little bit better or specifically try to limit their progression by using things like SGLT2 inhibitors, targeted budesonide, and we're even starting to learn how to use some targeted complement blockade, but we're just sort of learning our way forward. Because we still have a large unmet need to really take care of patients with IgA nephropathy. Too many of them progress relentlessly towards kidney failure. And with the new medication, with Atrasentan, it's really important to understand that clinicians have been trying to block endothelin, a really powerful hormone that increases the blood pressure and in the kidney can amplify inflammation and scar formation, particularly in IgA nephropathy. So we've been trying to master these medicines, but previous generations of endothelin blockers had lots of side effects. We learned in a large study of diabetic kidney disease that Atrasentan could be very, very well tolerated. And it was thought that it would also be well tolerated in patients with IgA nephropathy. So it just makes really good sense for the disease. And Atrasentan can be delivered very easily as a once daily pill. And we've learned that it's really well tolerated. So it makes great sense, and it's really a great opportunity today for our patients. Yeah, so this was a global phase 3 program trying to balance patients at high risk of progression, people whose GFR was greater than 30 mils per minute, who had more than a gram per day of proteinuria, but taken from Asia, the US, Europe, Latin America, and really a broad diverse group of patients with high-risk IgA nephropathy, where it's absolutely critical to address their proteinuria, which is the main marker that correlates with their risk to develop kidney failure. And patients were randomized to placebo versus Atrasentan. and followed for an initial 9 months, where the primary outcome was proteinuria reduction. And patients continue in this phase 3 study looking for a 2-year outcome of GFR stabilization compared to placebo. So it's a very large study. It's taking high-risk patients and giving them oral medication. It's important to note that the patients are all maximally treated with blood pressure control, with RAS inhibition, and many of them are already on SGLT2 inhibitors. So we're looking at additive benefits in a well-managed population. The early results from the study in a well-powered group does show a very substantial reduction in proteinuria. The group on atrasentan had a 38% reduction in proteinuria, which correlates with a very, very outstanding chance that it'll be associated with stability of their kidney function. And that's what had been seen in earlier trials of atrasentan in kidney disease. So we're really very, very excited about it. Again, it was very well tolerated in this population, with the blood pressure being stable. There's always concern for fluid retention, but there was just a hair more fluid retention seen in treated patients than in placebo patients, and no obvious heart failure. So that's really outstanding. Patients stayed in the study, and the benefits look to work across all subgroups of patients, whether they're older, younger, from different parts of the globe, had higher or lower proteinuria, higher or lower kidney function. So it looks like it's a medication that can be added to high-risk patients to really get to our goal of well-controlled proteinuria, and that it does that with limited side effects. Again, it's an amazing time where patients with rare kidney diseases, including IgA nephropathy, really have options to address their disease, to improve their proteinuria in a well-tolerated manner. And it's really important, and I'm so thankful for you to get the word out that new drugs like atrasentan really do give us a handle on treating these patients and hopefully provide them better outcomes.